in a traditional setting where you might be by yourself seeing a panel of patients, you still have somebody to fall back on, somebody to refer up and discuss certain issues. Here, we have that close-knit group where we're always talking with our surgeons, we're always collaborating, and increases our patients' access to care. It allows them to get into us quicker. I mean, as a PA, I do two joint injection clinics a week, whereas previously we may not have been able to see that much. Now that decreases some of that access to care time, and I think that team-based role allows us to do that better. The support we get from our surgeons, I think, is phenomenal. I think that Dr. Steele and Dr. Smith both understand the importance of a physician assistant, and the surgeons understand that we do add that increased access to care for our patients and continuity of care.